talk on something that some infectious process. Does anybody have any ideas? Anybody want to?
Oh my gosh, there's 3 more.
I'm sorry, I didn't hear.
We're gonna have to sit on each other's laps now.
She's not here, by the way, so there's nobody here, all right? So you know that, all right? So she came into me, and she had been chronically fatigued, chronically ill, chronic headache for years. For years, okay? And she went to her physician, and her physician looked at her and said, "That's just the way you are. You're going to have to live with that," okay? Now, I hear that a lot, okay? I hear a lot from my patients. So, how would you like to be that girl? Okay? You know, and she is, I won't tell you what she does, but she's really active, and she has a really active job, and she needs to have energy, and she needs all her faculties and all her energy to do what she does.
I get a new doctor.
Okay? So, well, that's why she came to me. Okay? So anyway, that's what I see. So I want you guys to think a lot more deeply and a lot more intelligently about illness and why people have chronic problems, okay? And we're going to talk about how we fix those issues tonight. Now, I think it's in April, I'm going to do one on small intestinal bacterial overgrowth and problems in the GI tract. And that's going to be another one that we're going to talk about some things such as we are tonight. So stealth pathogens, what are they? It's any pathogenic microorganism that basically hides from the immune system, evades the immune system, okay? So can anybody think of a pathogen right now that's in the news that might qualify for that? The coronavirus is a stealth pathogen, okay? So what makes a pathogen, what makes the coronavirus stealthy? Does anybody have any ideas? What makes it a stealth pathogen? Okay, but what is it about it that makes it stealthy?
Because you don't know where it originated exactly.
Okay, but let's say we did know where it originated from, but what makes it so hard for the body to kill? Okay?
It hides.
It hides. Why? Why does it hide?
Because it doesn't want to die.
It doesn't want to die. Okay. All right, go ahead. You guys are grasping for straws here, okay?
It wants to harm your body, and if your body finds it, it kills it.
But what makes it stealthy? What makes it the inability of it to evade the immune system?
Does it mimic something that's healthy in the body?
Okay, you're getting warm.
Okay.
Okay, warm, yes.
Try?
Well, you can try, Neela.
Maybe because we have no antibodies yet for it.
Okay, we can kill it. I'll just tell you, there's a protein coat around it, okay? It's a virus as a protein coat, okay? So the body sees that protein coat, and it says, hey, it's just protein. You know, I'm not, you know, it's no big deal. So we have to do something to rip off that protein coat.
It's an imposter.
So I will show you that in a little bit, how to do that. All right. So stealth pathogens can include bacteria, molds, yeast, viruses, spirochetes, and parasites. So common symptoms of stealth infections include, and you've seen some of these, fatigue, okay, insomnia, anxiety, muscle pain, cognitive impairment, weight gain, recurring infections. This is one I see a lot, and just poor health, okay? This includes 60% of our country at least, maybe more, okay? So a lot of people have this stuff going on. Stealth pathogens have been linked to a wide number of health conditions. So chronic fatigue, fibromyalgia, although I think a lot of fibromyalgia actually comes from automobile accidents, but there's some that can come from other things. Sarcoidosis, which is a breakdown of connective tissue. Cancer. Autoimmune disease is a big one. You have an autoimmune disease, chances are there's a stealth pathogen involved, okay? And Lyme disease. Lyme disease is a classic one that can evade the immune system. It does it extremely well. So here's some autoimmune diseases associated with stealth pathogens: ankylosing spondylitis, Crohn's, type 1 diabetes, Graves, MS, rheumatoid arthritis, psoriasis, Sjogren's, lupus, ulcerative colitis. And here's a pretty big one, is hypothyroidism, okay? Does anybody here read my Facebook posts? I know you do. Yeah, okay. So this question was on there last time, okay, about Hashimoto's, okay? So so the answer was not stealth pathogens or infections. In fact, infections can cause a lot of this, okay? So I won't tell you the answer. You have to find out tonight. All right. So with stealth pathogens, your body has been hacked by a pathogen that can invade the immune system. And, you know, a lot of times this comes from like past infectious diseases. For example, people that have had food poisoning, they're never quite the same again. Montezuma's revenge, okay? You know, I had that in Haiti. It's nasty, okay? What is it?
Yeah, what is it?
It's like
Diarrhea.
really bad diarrhea, vomiting diarrhea.
Okay.
Yeah, it's not much fun. Parasites picked up in foreign countries, bouts of mononucleosis. This is a common question I ask patients who are fatigued a lot. Like, have you ever had mono, and how many times have you had it? Chronic diarrhea. All of these things can be associated with stealth pathogens. So how do we effectively and naturally eradicate these things? Well, we have a protocol. We have very specific herbal formulas for it. So one is myrrh forte. Myrrh, remember that that was brought by the wise men to Jesus, gold, frankincense, and myrrh, okay? Very powerful antibiotic that doesn't screw up your gut bacteria, okay? Another product called artemisinin, Viranon, which is a combination of 3 herbs, and then we give immune support. Now, myrrh and part of Viranon actually will rip off the protein coat of stealth viruses, okay? Some other things will do it too. Licorice will do it. Licorice is an herbal product, really good for adrenals. That'll pull off the protein coat off a stealth pathogen. And so will a product called monolaurin, which has been around for a long time. So there are things that you can take that will actually expose these viruses. So the question you're probably thinking is, then why aren't they doing that to all these people that have, you know, like SARS was a stealth pathogen. So why aren't they doing that to people with stealth pathogens? Because very, very simply, the medical profession doesn't use this stuff. I mean, that's the answer, okay? That's why they don't do it, because they don't use this stuff.
They'll make no money off of it.
So let's talk about myrrh forte. It comes from these stems. It's actually secreted as a sap by a tree in Africa. It's antimicrobial, anti-parasitic, anti-inflammatory, and it's a good remedy for wounds. Clinical studies suggest using high doses for treatment of parasites that infest deeper in the body. Other uses include, you know, gum issues, gingivitis, mouth ulcers, colds, bronchitis, diarrhea, gut, liver, and bladder parasites, boils, and abscesses. So, you know, if I were going to a foreign country, especially a third world country, I would take some of this with me, okay, just as a precaution. Some of this, and I have some other products I would probably take also, but this is a great product. It's not liquid, which is great because you can carry it in your luggage. You can carry it on you. And it's really good for any kind of infection that you might get, and as a preventative. Artemisinin is another one. The common name is sweet wormwood. Historically, it's used to treat malaria. And now there's a guy that won a 2015 Nobel Prize in medicine for its effects against malaria. So it's very powerful for that.
Wormwood's a parasite cleanser. I mean, it helps to kill
Yeah,
parasites.
there's a couple of different types of
Okay.
wormwood, okay? So this is a different type of wormwood, but yeah, you're right, there's other kinds.
I've just heard of the plain old wormwood,
Yeah,
but I've
yeah.
never heard of sweet wormwood.
Artemisinin also includes sarsaparilla, which is used against syphilis way back in the Middle Ages, or a little past the Middle Ages. It's a blood cleansing herb. It's anti-rheumatic, anti-inflammatory, and this is something that'll help decrease the symptoms of bacterial die-off. Now, the one of the issues with this protocol I'm giving you is that if it'll really kill this stuff off pretty good, and sometimes so fast that the body can't keep up with the bacterial die-off, so sometimes you got to go slow. Viranon contains St. John's wort, licorice, and a product called Thula. St. John's wort is a very powerful antiviral product, which actually it's one of those products that rips the coat off of stealth pathogens. So St. John's wort is also used for what? Elevating mood, right?
Yes.
Okay. It's also very powerfully antiviral. And I use it more for viruses than I do for mood, actually. I use St. John's wort a lot. Well, here we go. For people that have, God, what's it? I hate it when I forget things in front of people. What's that problem where you get those really painful sores all over your body?
Shingles?
Shingles, yeah, shingles. That's what I'm trying to think of. That's what I use St. John's wort for. I use it for shingles, okay? I use some other things for that too. But it works well on enveloped viruses, good for oral and genital herpes, can be used as a preventative, and of course it helps support mood. So licorice high grade is also in this. It's effective, again, against enveloped viruses, effective in encephalitis and influenza A, supports gut barrier integrity and healing, and good for adrenal function. So licorice is it's an adaptogen, which means it helps modulate the adrenals. So what are the adrenals for? Anybody? Stress. Yeah, they help with stress. So when you're under a lot of stress, what happens to the adrenal glands?
Brings that cortisol.
Yeah, cortisol goes up at first, and then it goes down later. And what does elevated cortisol do to your brain? What'd you say?
It's bad, she said.
Bad, that's right, it's bad, okay. It kind of acts like a blowtorch on your brain, okay, elevated cortisol. So that's what long-term stress can cause cognitive dysfunction. And after a while, it causes fatigue. And so licorice is really good to balance out the adrenal glands. What else do the adrenals do, by the way, besides energy? Anybody? Okay. Those of you who listen to my talks a lot should be able to know this in your sleep. Okay. Anybody else know what the adrenals do?
Regulate hormones.
Yeah, they do. They do. They help regulate hormones, especially as you get older in life. Really important for that. Great answer, by the way. They also help regulate blood sugar. Okay, really important. They work with the pancreas to help regulate blood sugar. So when your adrenals are really off, okay, it can help. It imbalances blood sugar. This is the other part of this complex. This was usually in the past used for warts. Okay, it contains essential oils. You can apply it topically. It's antimicrobial and antifungal. And finally, echinacea. Echinacea is just a great product to stimulate immune function. Pathogenic actions include bacterial, viral, and fungal. So we use that just because it helps immunity. So garlic is another thing that can be used for stealth pathogens. Very good for mold and fungal overgrowth. So people that have like yeast infections, garlic is really, really good for that. We can get it, and you can get it in capsules from me, or you can just chew it, just raw, and it's pretty good. So the protocol can be mixed and matched. Another thing that garlic does, I didn't know I had another slide on this. Garlic is really good for clearing up what are called bacteria. Over time will make a sheet in your colon or in your body, and it's impervious to antibiotics. Well, garlic will actually penetrate that and break it up, okay? Which is really, really important, because when that happens, and it makes whatever you're dealing with completely impervious to antibiotics. So garlic is something that can really break that up. This protocol can be mixed and matched depending on the pathogen we're trying to eliminate. So I try and figure that out through laboratory testing. And then here's a typical protocol that you'd follow. Days 1 through 4, you do myrrh and artemisinin. Days 5 through 14, Viranon and echinacea. Now I have 4 to 8 a day. What I found is that 4 to 8 is maybe a little high for some people. I mean, 1 to 2 to start out with might be a little bit more appropriate, because it just kills it off too fast. Good. So that is what I have for stealth pathogens. Does anybody have any questions about anything I've talked about? Yes.
Is the protein wrapped virus, is that something different than a biofilm? Or the biofilm
Okay.
you were saying garlic helps with?
The biofilm, that's the word I was looking for, yeah, very differently. See, a biofilm is where you have an entire, it's like an apartment complex of bacteria, okay, that make this film over it's usually in your GI tract, and it makes it impervious to antibiotics, and it's like this very large apartment complex of bacteria, and they're hiding in the apartments where antibiotics can't get them. So the only way you can kill them off is to do something that will break up the apartment complex. And so garlic is one of those things. Another thing is lactobacillus will do that too. So that will actually do the exact same thing. But what we're talking about 2 different things here. So enveloped viruses have a protein coat around them, and they just float around in your body and they evade the immune system, okay? So what these products will do is they'll help rip that coat off of it. They won't necessarily, I use garlic to penetrate the biofilm, okay? They won't necessarily always penetrate a biofilm, but garlic will, okay? Garlic and lactobacillus will. So it's like 2 different things. Mm-hmm. So if for example, if I were to come down with the coronavirus, this is the protocol that I would use. Okay, exactly what I'm talking about here. Okay, if I were to go over to China right now, if I had to go over there for some reason, I'd take all this stuff along with me, and I just take it as a preventative.
Have Jim take all that when he goes.
Yeah, because he goes over there a lot, doesn't he?
Yeah.
So, so that's what I would do. And if I got any kind of viral infection, this is what I would take. Any kind of bacterial, viral, anything chronic, I would start out with this. There's some other things we can do too, but this is what I would use. Okay, anybody else?
Are they expensive, the herbs?
Carmen,
Yes.
how much are these?
The Vironon's 52, the Echinacea's 34, the myrrh is in its 30s, and I think the artemisinin is also $52.
So I don't know if that's expensive or not.
I mean,
no.
so to get started on it, you're looking at probably
Cheaper than going to the hospital.
$150 to get
That's
started.
good.
It depends. The myrrh only comes in one size. The artemisinin and the Viranon, they are a larger size. We have 2 sizes of the echinacea. We have like a 40 count, and then we have a 120 size bottle. So, yep.
Yeah, so it is cheaper than going to the hospital. A lot cheaper than going to the emergency room and getting treated there. So you can always do that, but I would try something different first if it were me. Yeah.
Now, like with the cancer cell, doesn't it have a coating on it too that it's hard to kill? Do you know anything about that? If it has a protein coating, or does it have
Yeah, with
something coating that's
well,
harder to get to kill?
cancer is a little different animal because with cancer you have to deal, and I have that whole talk on cancer, you have to deal with how those cells are being fed. What's causing the energy? What's causing the energy to make the cancer grow? Okay. So does anybody remember what that is? Sugar. Right. So you have to get the patient off of carbohydrate, of any refined carbohydrate, because that feeds cancer. So that would be the first thing that I would do. Now, if there are some studies that show that some cancers are associated with stealth pathogens, so you could use it for that. But anybody that's got cancer just can't eat sugar, because we know for a fact that cancer feeds off sugar. And another thing that happens with cancer, and I wasn't planning on getting off on this,
sorry.
but I'll just say this one other thing, is that cancer is also a problem with mitochondrial breakdown. Okay, the mitochondria, the things in the cells that produce energy, break down. This has been known since the 1920s. Okay. By the way, do you know who discovered that? Anybody? It's in my cancer talk. Remember the name of the guy? Otto Warburg. Greatest scientist who ever lived that you've never heard of. Okay. His best friend was Albert Einstein, and he won a couple Nobel Prizes. Most people never even heard of him. He's the one who discovered all of that. So, anybody know a drug that decreases mitochondrial function that a lot of people take? It's not the one I'm thinking of. A lot more people take this than do chemo.
Statin or?
Yes. Yeah, you got it.
Statins.
Statin drugs. Statin drugs
Statins.
poison your mitochondria.
Yep, they do.
So, I mean, connect the dots. All right. That's why I'd never take a statin drug.
What's a statin drug?